Good evening from New York. I'm Chris Hayes. Back in the earliest days of this pandemic, when the virus was only in one province in China before it reached our shores and spread all across the globe, tens of thousands of people in Wuhan gathered for an annual tradition. It was a Lunar New Year mass banquet. 40,000 families prepared nearly 14,000 dishes, and the organizers were going for a world record for number of dishes served to mark that event's 20th anniversary. Attendees sat close together, sharing the meal, and soon after, people began getting sick. And 57 residential blocks within the Wuhan neighborhood that held the banquet were labeled fever buildings. Now, looking at those images now is really gut-wrenching. Soon after, people began getting sick. And 57 residential blocks within the Wuhan neighborhood that held the banquet were labeled fever buildings. Now, looking at those images now is really gut-wrenching. It's fair to say it was most likely not a good call to go ahead with that event. But again, this was mid-January. I mean, the Chinese government was suppressing information about the virus. Most people did not understand yet what we were dealing with. But now, 7 months after the first case popped up here, we have a better sense of what this pandemic is, or we should. We know that as a country, we need to avoid big gatherings with no social distancing, particularly indoors. So no nightclubs and no bars, no frat houses, no big, massive events. And if we wear masks and we are careful, well, maybe we can muscle through this and lead a semi-normal life. Well, this was the scene in South Dakota last month, the Sturgis motorcycle rally held over 10 days. Now, this took place 7 months after the Lunar New Year banquet in Wuhan, China. At the start of this event, 160,000 Americans had already died. And it has been abundantly clear for months that big events, mass gatherings without social distancing, are extremely high risk for spreading coronavirus. But South Dakota's Republican governor, Kristi Noem, did not want to hear that. She's a rising Republican star. She recently hosted the president at Mount Rushmore and lectured about violence in the streets during the RNC. And just the other day, showed up at a Republican Party event in Iowa, appearing to set the stage for a future run for president. And Governor Kristi Noem has made it her regular practice to thumb her nose at all those condescending liberal talking heads who say we should take the pandemic seriously.
There's concern about this big motorcycle rally that's happening this weekend in South Dakota, and we don't have to play the soundbite. Oh my God, on television, all the cable news. How dare you? It's going to become a super spreader event, Governor, a big super spreader event. Look at all those people. Look at how they gather.
Well, we've had several big events in South Dakota already. We had the first spectator-attended professional sport. The professional bull riding was held in South Dakota. We had the July 3rd event and saw no increase in cases because of that crowd that gathered to celebrate our country's freedom and independence. People have been gathering. We've been back to normal for over 3 months here in South Dakota. So we know we can have these events, give people information, let them protect their health, but still enjoy their way of life and enjoy events like the Sturgis motorcycle rally. We hope people come.
We hope people come. We're back to normal. We're back to normal. The virus went away. Now, it is important to consider the scale of what we are talking about here with the Sturgis motorcycle rally. Remember the big outdoor crowds we saw at protests in the wake of George Floyd's death? A lot of people, including myself, as I said multiple times in the show, were really concerned that those events could lead to a lot of spread of the virus. But, months have gone by and the evidence suggests they did not, thank goodness. And part of the reason for that is because of the scale of those events. In New York City, a city of 8 million people, tens of thousands of people took to the streets. And the protests themselves stopped other people from going out. And so they didn't lead to big super spreader events. Sturgis, South Dakota, on the other hand, is home to 7,000 people. And this year's motorcycle rally drew over 460,000 people, like dropping a city the size of Miami into the middle of a small town. So what happened? New research by health economists concluded the Sturgis rally led to over 260,000 additional coronavirus cases, or get this, nearly 20% of the new cases in the U.S. between August 2nd and September 2nd. 20%. Now, it's important to note, this paper is still under peer review. But look at this map. I mean, people came to Sturgis from all over the country and then, of course, returned to their homes and communities spread from coast to coast. The researchers have calculated the total public health cost of all of these cases at over $12.2 billion, which, get this, is enough to have paid each person who went to Sturgis over $26,000 not to attend. Just stay home. Now, like I said, it's preliminary research. It's not yet peer-reviewed. But think about it this way. Even if this study is off by, say, I don't know, a factor of 4, okay, it's still nuts. I mean, I wonder what the residents of Wuhan are thinking about us right now. 6 months, 7 months into fighting this pandemic. And there are still so many difficult decisions and balances of costs and benefits. For instance, schooling, which we've been talking about a lot on the show night after night. There are so many questions where it's still hard to know what the right answer is. But then there is a subset of stuff that is real easy. Like wear a mask and don't hold events with 400,000 people. But in America, we cannot even do those things. And that is because our attitude about the virus stems in part from the top, from the president barking at a reporter petulantly yesterday to take off his mask, to the rising star governor of South Dakota positioning herself in opposition to public health experts. We're back to normal. And of course, who can forget former Trump advisor Kellyanne Conway, seen here on the Oval Office sofa, talking about having it contained way back in March.
You talked about how the administration initially had this contained, but during that time, why did the administration send out more tests and work to get hospitals prepared? I mean, even today, the state of Florida is saying they can't test everyone per the administration's guidelines because they don't have enough tests.
So you're asking a couple different things there. I'll try to just give some facts. The HHS secretary said this morning that we're ramping up. We're ramping up with commercial labs.
Why didn't they do it while it was contained? Get ahead of it.
It is being contained. And do you not think it's being contained in this country?
I'm not a doctor, I'm a lawyer.
Well, but you said it's not being contained. So are you a doctor or a lawyer when you say it's not being contained? That's false. You just said something that's not true.
Ah, yes, that little vicious, condescending parry at a reporter who's asking a question. That moment, by the way, should be what everyone remembers about Kellyanne Conway, maybe the only thing they remember about her contribution to public life. And that tone seen there, that petulant tone, it has not changed in 6 months as we tick towards 200,000 dead Americans. It's why we are where we are today. It is why we are still holding huge events without much social distancing over 7 months into this. Joining me now, one of the researchers who co-wrote that Sturgis study, Andrew Friedson. He's associate professor of economics at the University of Colorado, Denver. Good to have you, Professor. I want to start first with just the methodology here. Like, how solid is this? How confident are you that the modeling you've used here is getting it right about what the effect was?
Yeah, I'd even push back about characterizing this as a modeling exercise. What we're doing here is we're taking locations that are heavily exposed to the Sturgis rally, either Meade County itself, or locations that we see a large number of cell phones traveling from those locations to Sturgis itself. And then we're comparing those locations to similar locations. They're on the same trend, have the same number of COVID cases, and we're just matching them up and showing they lay right on top of each other ahead of the Sturgis rally. Then post-Sturgis rally, the places that had high exposure to Sturgis diverge, and they start seeing an uptick in cases relative to places that had the same levels and the same trends. This is all based on actual data and actual numbers. The only modeling assumption going on here is that you've got places that look identical, that some places were exposed to Sturgis and some places weren't. And if you buy that, then you buy the analysis.
Right. So you've got County A and County B, and these counties are fairly similar counties before Sturgis, and you can look at why they're similar and similar vis-a-vis COVID, and then you know that a bunch of people from County B went to Sturgis because you have the cell phone data, but no one from A went, and then you start to see that rise index up a few weeks after Sturgis in the county where people were coming back from the rally.
Yeah, and then we can count up the actual differences in cases. This has been characterized actually by the governor of South Dakota as a BS model, and it's not at all. It's actual comparisons.
Were you surprised by what you found? I mean, the numbers here, the thing that jumped out at me was the 20%. And I guess that jumped out at me before I quite realized the scale of the event they sent, but 20% of the cases, 260,000 cases, the level of illness and disease and death and cost is staggering.
Yeah, it shows how much a single event or a single large event can contribute to the national spread. This is what exponential growth is, right? You have a large number of people, and then they all touch two people, and then they all touch two people, and it just goes off and off and off. The thing that really jumped out at me was how much of the numbers, or what percentage of the numbers, come from outside of South Dakota. That we only have about 3,000 additional cases due to the Sturgis rally, according to our analyses, in South Dakota, whereas the rest of the country accounts for everything else. So this is a situation where all the economic benefit of having a large event like this rests in a single state, and all the public health costs is borne by everybody else.
That's a great point. It's like a massive pollution enterprise, right? Like the negative externality gets thrown all across the nation, and the businesses and all the folks who count on it. And I understand 100% why, if you're a person in Sturgis or around Sturgis, you want that event to happen, because obviously there's an enormous economic engine for the people around there in the state, and it would be crushing if it doesn't happen. But now you've got 257,000 excess cases around the country.
Yes, that's correct. And I get it. People are tired of the disease. I'm tired of the disease, but that doesn't change the facts on the ground that this is still an incredibly infectious and incredibly deadly disease.
Andrew Friedson, who's a professor of economics there at the University of Colorado, Denver. Thank you. That was great. Really appreciate it.